Today we have with us Dr. Imran Waheed, who's a consultant psychiatrist and has very extensive experience in producing psychiatric reports. Dr. Waheed is also a director and founder of psychiatricreport.com, and he joins us today to discuss his experience in being an expert witness and what got him interested in doing expert psychiatric reports. So Dr. Waheed, can you tell us how you started off in expert reports in psychiatry?
Yeah, I guess the main interest was when I was training. So training in psychiatry when I was doing what is known as higher training. One of the last consultants I trained with, we would have weekly supervision, and he would always discuss the most interesting cases. And these were as a result of his medico-legal work. So he was somebody who was an established expert witness and still is a very well-established expert witness in the field of adult psychiatry and particularly liaison psychiatry. So yeah, I mean, that's what stimulated the interest, that I actually saw his interest, his passion in psychiatric report writing. And yeah, I mean, he had so many excellent cases that were really, really interesting and wide and varied, and to some extent different to what we were seeing in our day-to-day work in the NHS. The other thing, of course, was that it seemed to give you an opportunity to really use your expertise in a different way, to think in a slightly different way. So usually one who is a doctor uses your expertise to diagnose and treat the patient. So you are using similar skills, but you also need other skills, and it allows you to develop those skills for the ability to quickly assimilate lots of information, for example, from reviewing a patient's past medical records in a lot of detail. The need to assimilate information from legal documentation, for example, reading witness statements or claims or other legal documents, and the ability to understand all of those things. The skills to liaise with people from a different profession, from the legal profession. So all of these things were things which were quite interesting. The other thing, I guess, which also attracts you to it is you have the ability to look at things in a great amount of detail. And that usually, for most people who work in the NHS, you don't necessarily get to spend that amount of time seeing, for example, if you saw a patient in an emergency, in accident and emergency, you wouldn't spend several hours with that patient and also have the time to, review 1,000 pages of medical records. And you wouldn't want to, and it wouldn't be needed to deal with the patient's immediate difficulties. But the ability to do that is also something which greatly interested me.
So, I mean, what would you say to, a young psychiatrist who's coming to the end of their training period, or just coming to being a young consultant? How would you suggest to them that they should, if they were interested in doing psychiatric reports, how would you suggest to them to get onto the ladder, as it were, to get onto into doing psychiatric reports? Of course, there are people who, and we come across them, when we're arranging the reports, that whilst they're experts in their field, they're not really that keen on doing psychiatric reports, but there are other doctors that are. So, I mean, what would you suggest to those that are?
Well, look, I mean, you raised a number of points. The issue there is not everybody wants to do additional work, because this work is additional to the work one is usually doing. So if you're a full-time NHS consultant and you don't want to spend any extra time doing any additional work, then even if you are an expert in your field, you may not be interested in this area of work. There are some colleagues who are just doing part-time work or less than full-time work, and they don't want to do any extra work. So again, that may be the reason for not pursuing medico-legal work. There are others who have no interest in it, or very little interest in it, or who have other commitments. which prevent them from doing this kind of work. Some, I guess, have not got experience, and some are worried about the the potential pitfalls, and dealing with courts, and they view courts and the legal process as being something intimidating, or something that is foreign to them. So as a result of that, they feel that their training hasn't prepared them adequately. So in answer to the first part of your question, people who are finishing training or who are newly appointed consultants, well, I think it's important while you're training. I certainly found it during my time of higher training, if you can find consultants and trainers who have an interest in writing psychiatric reports, it's very helpful to shadow them, to prepare reports under their supervision. I think that's something quite good. And even once you're a new consultant, you can also seek out people who have an interest in mentoring and who have an interest in report writing, and you can ask them for their advice and to shadow them.
I mean, we've had cases where we've had psychiatrists who are in higher training who've produced actually psychiatric reports under the supervision of a consultant. So if somebody's interested, they can still produce reports as long as they have a consultant to sign off those reports. It's something that we've come across in the work we do in psychiatric reports, but I don't think that's a common practice, though.
I'm not so sure that it's not a common practice. It's a fundamental part of training, particularly in forensic psychiatry. So in forensic psychiatry, you cannot complete your higher training without writing psychiatric reports. It's fundamental to the role. And I would argue the writing of reports, even if you're not going to do medico-legal work, is a fundamental part of training. And that's why higher trainees who are finishing off their training in psychiatry, they really have to seek out these opportunities. Because although you might not go on to do expert witness work, any consultant psychiatrist could be called on to write a report, for example, a report for the coroner's court, a report about their own patient for the family court, for criminal proceedings, in relation to the Mental Capacity Act. So even though one may not be pursuing this as a regular source of work and a regular source of income, it is an important skill to have for any consultant psychiatrist. So, I mean, I agree with you that, mainly the field of people doing these reports is dominated by experts. And if they are experts, then they will generally be consultants. But there is nothing to stop more junior doctors, so what we call specialty doctors, for example, from working under supervision. And that is the way one develops one's skills in medicine. You work under supervision, and that's what I did. You work under supervision, and even once you are, an expert witness in your own right, while your work may not be supervised, it's important for that work to be considered as part of your appraisal. It's important to have discussions with peers, and for example, there are avenues where one can particularly address one's CPD needs in relation to the expert witness work. So, for example, most main cities have medico-legal societies which one can join. So in Birmingham, we have the Birmingham Medico-Legal Society. And this provides an avenue to meet up with peers who are also doing medico-legal work and to discuss cases with them. So case-based discussions, all of this is very, very important. So even though you become a consultant psychiatrist and you start writing expert reports, it's important to keep your skills up to date. And it's important to have ongoing discussions with other colleagues and professionals about your cases.
Okay, before we wrap up here, can you talk about the amount of time that it takes to produce a report, and what typically you would need to, what steps you would need to go through before the actual production of the final report? Would you be able to talk about that? Just kind of expand out on that a little bit.
Well, obviously it varies depending on the complexity of the report. So the components usually of the report are the time spent reading documentation. So for example, you may have a letter, well, you should have a letter of instruction from whoever is instructing you. There may well be other legal documents related to the case. There will be medical records which need to be reviewed. So all of that needs to be accounted for, and that can take, a number of hours. It could take, for example, I mean, if you talked about an average case, you might be looking at, between 6 to 10 hours of reviewing documentation. Of course, there are some cases which are very, very complex and involve reviewing thousands and thousands of pages of medical records, and they will, of course, take much, much longer. Then there's the time spent with the patient, the assessment of the patient, and that can also vary depending on the level of the patient's engagement and the severity of their illness, and how well they are able to engage with you as an expert witness, whether they're willing to speak to you or not. So, the shortest periods I've spent are probably 15 minutes, where an individual has been completely unwilling and has been very reluctant to take part in the assessment. For example, sometimes one visits a prison and you may find the individual is unwilling to cooperate in the process, and it may be difficult to have a lengthy assessment. But sometimes you may end up seeing the patient for 3 or 4 hours, or even splitting up the consultation so that you see them for 2 hours and then a further 2 hours, depending on what is needed. The average is somewhere in the 2-hour region, though. And then, of course, there's a preparation time, which is assimilating all of that information that you have reviewed and combining that with your assessment of the patient and your knowledge and your expertise to answer the questions that have been put to you. And again, that can take a number of hours. So yes, each piece of work is considerably time consuming. And that's important because, the implications and the ramifications of these reports are important in terms of the legal process. So one has to make sure that we get them absolutely right.
What a lot of consultants on our panel find is that they find our service to be useful because it takes out all the administrative hassle that they could potentially have in terms of submitting the report, dealing with communications with the solicitors, collating the documentation, and also then after getting the report submitted, then credit control and making sure that you get paid for the report. So our service that we offer takes all that headache away from a lot of the consultants. Some consultants prefer to do it on their own, but the service that we provide for consultants is one where they can just focus on doing the report itself, look at all the technical aspects, produce a high standard report, and not worry about the issues about finding work or finding reports themselves and being continually kind of bombarded by questions and inundated by questions and inquiries. So, I mean, we provide that service which kind of helps consultants. I think that's one of the biggest stumbling blocks that a lot of consultants have, that once they actually get into, and I've come across consultants who've stopped doing it because they just felt themselves to be too busy to do psychiatric reports and chase up all the administration that goes along with it. And so, we at psychiatricreport.com, that's what we do. We kind of manage that package for them. Yeah. So it's if somebody's interested in that, please feel free to contact us, and I'm sure Dr. Waheed will be happy, for an initial chat if somebody wants to do it. Is that the case?
Yeah, it is, and the whole reason why years ago I established psychiatricreport.com was to have that kind of one-stop shop for the legal industry to come to. To get excellent quality psychiatric reports, and the benefits for psychiatrists are exactly, what you say, that, it takes out a lot of the headache, and you shouldn't underestimate that headache, particularly the credit control side of things. I remember that, often, that was a real problem for myself and a lot of colleagues, was how to get paid. And I guess that's one of the things that we take out of the equation.
Okay, thank you, Dr. Waheed, for joining us today, and we hope to have you on again in the future.
Thanks for having me.